Welcome to this educational program. This module discusses foreskin care for boys. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. At birth, the head of the penis, also called the glans, is covered with a layer of skin called the foreskin, or prepuce. In fact, before birth, the foreskin and the glans actually develop as one tissue. The foreskin consists of two layers. The outer skin you can touch, and an inner lining similar to the lining on the inside surface of your lips that lies against the glans. The foreskin serves a protective role early in life. Since the glans is quite delicate, it can be easily irritated by urine or feces. The foreskin helps to prevent this irritation. The foreskin may also help prevent infection of the urinary tract by protecting the opening of the urethra called the meatus. As a rule, the foreskin is very easy to take care of, and in fact, the less interference, the better. Diapers should be changed frequently to prevent urine or feces from coming into prolonged contact with the penis. Wiping should be done from the front to the back, as you would for a girl. This will also help to keep the penis area clean. Cleaning your infant son's penis is easy. Simply use warm, clear water and a gentle touch. If desired, a mild soap may be added to the bath water. Do not use Q-tips to try to irrigate the area. There is no need. Clean only the outside of the foreskin, and remember, do not pull back or retract the foreskin forcibly in an effort to clean the glands. It is important not to retract the foreskin too early. Doing so can cause pain, bleeding, scarring, or tears in the skin, and tears can lead to infection. Foreskin retraction occurs at different times for every boy. Occasionally, retraction occurs in the first 6 months after birth, but this is not very common. Most boys can retract their own foreskin by age 5 or 6, but in some cases, retraction does not occur until puberty or the teenage years. And sometimes, although rarely, it doesn't happen at all. The foreskin naturally separates from the glans a little bit at a time, over months or years. Very gentle, partial retraction can begin by age 1 or 2 for most boys. Gently pull the skin on the shaft of the penis down toward the tummy. Stop immediately if resistance is felt or the child appears uncomfortable. The head of the penis will often appear bright pink or purple. Do not be alarmed, as this is normal. It is easy to clean the penis, even when the foreskin is partially retracted. Simply use a gentle touch and warm water. Gently wipe away any whitish material you see, which is called smegma. Smegma may look a bit like small pearls. It is made up of dead cells and is perfectly normal and nothing to worry about. If you notice a collection of smegma that has been seen or felt through the foreskin, but which cannot easily be reached, it should be left alone until further retraction exposes it or it works its own way out. It does not harm the child to have smegma build up under the foreskin. In fact, smegma helps break down the attachments of the glans to the foreskin, allowing retraction to occur. There is no need to use Q-tips or to try irrigating the area as mentioned before. It is very important to remember to always return the foreskin to its normal position over the glans. And make sure that if soap was used, it is completely rinsed off prior to returning the foreskin to its normal position. As your son gets a bit older, his foreskin will continue to loosen and separate from the glans. Normal erections during childhood likely help this process along. It is also normal for a child to discover himself and begin to explore his genitals, further promoting the separation of the foreskin from the glans. By the time your son is 5 or 6, he can begin to play a role in his own genital hygiene. Show him how to gently retract the foreskin during bathing, how to clean and rinse the area properly, and to always return the foreskin to its normal position over the glands when finished. This will likely require gentle reminders while he is young, but it sets the stage for a habit of cleanliness as he gets older. While care of the foreskin is quite simple and problems are rare, there are some issues that can occur and should be watched out for. These include altered urine flow, infection, and a stuck foreskin. Let's first discuss altered urine flow. Watch to see that your infant son is able to urinate freely. If the stream of urine is never heavier than a trickle, or if he appears to be uncomfortable while urinating, take him to his doctor as soon as possible. You may also notice what is called ballooning. This is a buildup of urine under the foreskin, and although it looks quite alarming the first time, it is actually normal and not a problem so long as the urine is free-flowing and your son does not appear uncomfortable. Sometimes the foreskin can look inflamed, in other words, red and swollen, and you may notice a yellowish discharge or even some bleeding. Your son may also be fussy and have a fever. This could indicate an infection, and you should contact your doctor for treatment within 24 hours. Another problem can occur when the retracted foreskin becomes stuck behind the glands, and you are unable to easily return it to its normal position over the glands. This condition is called paraphimosis. Try first to lubricate the glands and foreskin with a bit of warm water. Then gently squeeze the glands with your fingers to make it small enough for the foreskin to slide forward, like removing a ring from a finger. If you are unsuccessful, seek medical care immediately. In summary, the foreskin is a normal part of the male anatomy, and caring for it is really no different than caring for any other body part. The most important thing to remember in keeping the foreskin and penis clean is to use warm water with or without a mild soap and a gentle touch. While the foreskin is still attached to the glands, only the outside of the penis should be washed. Do not try retracting it too early. Simply let nature take its course and the foreskin will separate from the head of the penis all on its own. Keeping the penis and foreskin clean and watching out for complications that can arise should become part of you and your son's regular hygiene routine. Let your doctor know right away if you notice any alteration in your son's urine flow, signs of infection, or if you are unable to return the foreskin to its normal position over the glands. Your doctor is there to help. These resources may help you find further information about the care of the foreskin. We sincerely hope that this module has furthered your understanding of foreskin care for boys. For more information on this subject, please contact your doctor. Other modules are available through your doctor's office that discuss related topics.